everybody. My name is Tom Kirn, and no, I'm not a Tic Tac star. I'm the Director of Clinical Microbiology here at RWJUH University Hospital. Come on in, I'll show you around. State-of-the-art microbiology lab. I'm going to take you for a tour here and show you what a specimen goes through as it comes to the lab for processing for bacterial culture. So we'll start over here where we read gram stains. So specimens that come in for processing in the laboratory are put on a slide, and a gram stain is read at these microscopes. You can see Dr. Weinstein here diligently working away. In addition to gram staining, specimens are cultured, and the culture process involves pipetting out some of the specimen over here in this instrument, and then automatically streaking the plates on the instrument here. And the way that this instrument works is basically it puts the specimen on the plate, it puts a ball bearing on the plate, and then that ball bearing is struck using a magnet to spread the specimen all across the plate so we can isolate colonies. And then if we come on over here, you'll see here on this side of the instrument the plates come out and are stacked here. And once they're stacked here, they're fully inoculated and ready for incubation. So the technologist will take these plates out of here and then place them into our second instrument in the line here, which is our sorter and our incubator and our imager. And so the way that this instrument works is the plates are barcoded. They get sorted depending on how the incubation requirements that they have. They'll either go into CO2 or standard air environments. They'll be incubated for a certain amount of time depending on what type of culture they are. And then they'll come up to the top of the instrument here where each of the plates is imaged with a high definition image, both with incident light and backlit, so that the techs can evaluate the plates electronically at their digital workstations. So once the plates are imaged, they go back into the incubator. And so one of the advantages of a system like this is that the plates never come out of the incubator. They're constantly incubating, so things grow faster. Over here, and we'll take a look at what the plates look like on the screen. Arlene, can you help us out over here when you have a chance?
Oh, yeah.
Okay, thanks. Is going to help us out with looking at some plates here on the screen. And so what you can see over here on the right-hand side, on the right-hand monitor, is all the plates that belong to this culture. And so you can see blood plate, a chocolate plate, a McConkey agar, and so each of those plate types is inoculated with this specimen. And then if we zoom in on one of these, let me look at the, yep, okay, and you can see that the plate is divided up into 4 quadrants. Again, this was, the organism was plated here with a ball bearing. And then you can see that there's some isolated colonies there. And so Arlene has now circled one of those colonies with a number 1 there. And that's going to be worked up further. Once we've identified the colonies that we're interested in working up further, colonies that we want to get a formal identification on in susceptibility testing, we'll move on over here to where we do that work. Thank you. Yep. Come on, let's go look. Hey, look, we've got some plates moving around the track here. So they're coming down the track, and if Arlene over there told me that she wanted to work up one of the colonies that was coming through here, that plate would be spit out the back of the instrument, and I would pick it up. And then the technologist in this area would do the identification and susceptibility testing. So as those plates come off and the colonies are ready to be worked up, they get spotted on this, which is called a MALDI target. And the MALDI target goes into this instrument, which is called the MALDI-TOF. And the MALDI-TOF magically identifies the organisms using a spectrophotometric method that creates a fingerprint for each organism that's matched to a database. And so this rapid way of identifying organisms gives us an identification for those bugs that are growing on the plate within about 15 minutes or so. If the identification indicates that susceptibility testing is required, then that's done over here on this instrument, which is our automated susceptibility testing instrument. So the way that this instrument works is the organism is put into a cartridge. The cartridge has wells in it that has different antibiotics in it, and this will incubate those cartridges for a set amount of time and look for growth or no growth in those wells to determine if the organism is susceptible or resistant to the antibiotic that we're testing. Come on over here, let's look at this. So if all the stuff that I described to you isn't fast enough, we have faster ways of doing things for special kinds of cultures, specifically blood cultures. So we really worry about patients that have bacteria growing in their bloodstream. And so we have some rapid methods to identify and predict susceptibility for certain bacteria that grow in the bloodstream. And so one example of that type of instrument is here, this is called a Verigene instrument. So blood culture broth from a patient that has a signal-positive blood culture is placed into the instrument, and the instrument will rapidly identify gram-positive bacteria that are growing in that culture and also give you some molecular information about susceptibility predictions that can be used rapidly to refine antimicrobial therapy for those types of patients. For gram negatives, we use a slightly different machine, and that's these instruments called the Accelerate Pheno. And these are really cool. These are probably one of the coolest instruments that we have here. So basically, the blood culture broth is put into a little chamber. There's an inverted microscope under here that looks at the individual bacteria that are in that chamber, and then it watches them grow over time. And it watches them grow in the presence and absence of antibiotics. And what happens to the bugs, depending on whether they're susceptible or resistant to the antibiotics, is their growth and morphology are different. And so this can detect differences in morphology as a function of time and predict susceptibility to certain antibiotic combinations. And we use these for gram-negative rods predominantly. All right, so if that's not fast enough, we have something even faster. Come on, let's look over here. Come on, let's go. I think we all agree that the ideal diagnostic device would be one where you take a specimen from a patient, you put it into the machine gives you the answer right away. And that's essentially what these instruments do. So the range of organisms that we can detect is rather limited, but these instruments can detect yeast in the blood in a couple of hours directly from the blood specimen with no pre-incubation required. And so we can very, very rapidly determine whether a patient has fungemia or not using these two instruments. And the technology is also really cool. In addition to molecular techniques which hybridize to nucleic acids from those yeasts that are in the blood, it also uses magnetic resonance imaging to detect them. And so this is really state-of-the-art. This is really on the cutting edge of infectious disease diagnostics. Last stop on the tour, guys. We're going to go over to the virology lab and look at our molecular infectious disease testing section. Come on. Come on in. This is virology. So in this section of the laboratory, we mostly do virology testing. However, there are some bacterial targets that we test for too. And essentially everything that we do here is a molecular technique. What you can see over here is a Cephia Gene Expert instrument. This is that it's got many, many slots in it that are able to hold cartridges, some of which you can kind of see queued up for testing over here, the little blue cartridges that are barcoded. This allows us to do molecular testing for a variety of different targets, such as C. diff, influenza, RSV, COVID-19, etc., on demand, individually, one at a time, in each of these little chambers. So we can do many, many tests at the same time, but many different tests at the same time, and the results come out generally in about an hour. So this is a rapid, on-demand system for doing molecular testing for infectious diseases. And in addition to that, we're really looking for 1 or 2 or 3 different bacteria or viruses. We also have methods to detect many, many different organisms at the same time, and an example of that is over here. So this is called the GenMark DX instrument, and this instrument uses a cartridge-based system. It's kind of similar to what we saw with the Gene Expert, but in this case, it's massively multiplexed. So for example, we can do respiratory viral panel testing to detect 7 or 8 different kinds of viruses all at the same time. This could also be used for detecting many, many different organisms in the bloodstream, for example, or in a blood culture bottle, for example, amongst other uses. So this is massively parallel molecular testing for infectious diseases. Well, that concludes the tour of the virology laboratory. Come on out here and we'll finish up. It's been a pleasure showing you around our state-of-the-art microbiology lab here. If you decide to join us as a fellow sometime in the future, you'll have the opportunity to take advantage of all of the technology that we have here, both for your educational purposes as well as for patient care. Bye.